Our research into our scanning system in knee arthroplasty, where we want to scan the knee surface during surgery. The knee arthroplasty, the implementation of knee joints, is one of the most frequently performed surgical procedures of all. For the marker-free knee arthroplasty, our proposed workflow is an interoperative 3D scan of the knee surface, the trinocular SLAM, which uses a 3-camera system. You see it here in the middle. And after the scan, we want to align it with a preoperative scan and localize the knee and the leg axis. There are many challenges. It's necessary for the surgeon to move the knee during surgery, and we have just a small visible area, and the surface is really homogeneous, and we have reflections, shadings, or occlusions on it. The real challenge is that we don't have really good test data to test our application with our trinocular SLAM. I explained the trinocular SLAM, which started with a pre-processing task, and after it we use a keyframe selection where we perform image matching, where we use a feature matching, and we get a motion estimation and the trajectory. We use the trajectory and we use the known position of the images and our mask images from the pre-processing task to perform a patch match stereo and get a point cloud out. How can we test the trinocular SLAM in surgery application? For this task, we want to use synthetic data by Blender, and here are the main tasks: is image acquisition of bone structures. Our object is a scan by an artificial knee, a scan from a handheld scanner. And the second database is an SFM model, structure from motion, where you can see here. The first data set is about our synthetic 3D models. We have two image sequences for each camera from the trinocular camera system by a handheld scanner model, and from the structure from motion model. And we have the ground truths for the camera pose, and we have obviously the ground truths for the knee surface. And the second data set, we use the trinocular camera system too, but here we have synthetic camera motions, which is cross-shape. Our results, first we focus on camera pose. We compare our estimated position with the ground truths for each. That both deviations are on the same level, but SFM is slightly better than the handheld scanner and the Euclidean distance from the ground truth. If we look to the point clouds, where the handheld scanner model is not really works, we have large holes on it, and if we look to the SFM model, it's really better. If we compare the point clouds with the ground truth scan data, you see the handheld scanner model really doesn't work. But we have just, for the SFM model, we have just deviations from 0.5 millimeters, so you can see it. Most of these surfaces are green. If we look to our second data, how much is the rotation, what we can use around the knee to get a good point cloud. The best one is a 25-degree rotation. The second results from the data set, we increase the number of image triplets. We have at 25-degree almost the best surface. Our outlook, want to compare the real image data with surface reference, and we want to add reflection and wet surface in Blender scenario That's where more realistic data. We want to simulate knee motion, that we want to publish our workflow to GitHub, so you can use it open source.